Hello, and thank you for joining us. Today, we're going to answer some common questions about multiple sclerosis, or MS. Here with me, I have one of our neurologists, and I'm going to ask him to introduce himself.
Hi, I'm Sargon Bet-Shlimon, and I'm a neurologist specializing in multiple sclerosis here at Valley Medical Center. Before I was here at Valley, I did my residency and fellowship training at the University of Washington.
Excellent. Thank you for being here. Our first question today is, what diet should you follow if you have MS?
It's a good question that comes up all the time, and the short answer is that no diet has been proven to have any disease-modifying effect in multiple sclerosis. And the longer answer is you'll read a lot of things about anti-inflammatory foods or anti-inflammatory diets. None of that has really been proven to make a difference in terms of impact in MS. But I always tell patients it's okay to experiment and try these things out. And in part, the fact that we don't have good evidence that this really changes the outcome of MS doesn't necessarily mean that it couldn't or that there couldn't be some effect, but in part has to do with how these things are studied and the challenges of studying dietary changes in MS. One other piece of advice that I usually give patients is to consider a heart-healthy diet, the best studied of which would be the Mediterranean diet. And the reason for that is not because there's any direct effect on MS itself from these kind of diets, but because we do know that when cardiovascular risk factors like heart disease and high blood pressure and diabetes, things like that are not well controlled, people do tend to do worse with MS in the long run. So often taking measures to protect your cardiovascular health, including good diet and exercise and seeing your primary doctor regularly, are all good steps to take.
What about exercise? What kind should you do if you have MS?
I usually tell my patients that the most important thing is to find a form of exercise that you enjoy doing and that you can do on a consistent schedule. When it comes to MS, the other things to consider would be making sure that you are doing exercises that work with any physical limitations that you might have related to MS. And the other thing to keep in mind is that people with MS will often report a temporary worsening of some of their symptoms when they're exercising more strenuously. And that's something that relates to increases in your core body temperature. It's not unique to exercise, and it can happen in other situations. But the important thing to know there is that those changes are temporary. They don't indicate new damage or harm coming to you from MS, but it's something to be aware of that some people often will notice.
And are there natural or holistic remedies that can help treat MS?
Patients will sometimes report that different types of complementary or alternative medicines like acupuncture, chiropractic, things like that, may help with certain symptoms of multiple sclerosis or really a lot of other neurologic conditions. But the important thing to note there is that alternative or complementary medications, medical approaches, don't have a disease-modifying effect, which is to say that they won't alter the course of the disease in MS, and they shouldn't be considered as a replacement for the treatments and medications that we do use.
Is MS contagious or hereditary?
MS is not contagious. It's not an infectious disease. But the question of whether it's hereditary is a little bit more nuanced. So it's not hereditary in the sense that you are definitely going to have MS passed on from parent to child in the way that we think of some hereditary diseases. But there is a very small genetic component of increased risk if you have a first-degree relative with MS. It's relatively small. That's why we don't consider it to be a hereditary disease. But there is a very small genetic component there.
And if someone has MS, is it going to get worse?
That's a difficult question to answer because there's a lot of different factors that go into that. And it depends a lot on the person and how active their MS is. It depends on other factors as well, like how long they've had it, whether they're being treated for it, and their age. Many other things go into it. So it's a good question, but it's probably a better question answered on an individual basis.
Let's talk about treatment. How do drug treatments help MS? And is there a cure?
So unfortunately, there is no cure for multiple sclerosis, but we do have a number of disease-modifying therapies, which are treatments that alter the course of the disease. And the way that they do this is by reducing the chances that people would develop new attack symptoms or new scarring and damage that we can see on imaging studies like MRIs. And the overall effect of this is that over time, this reduces the chances that people would develop bothersome symptoms or disability in the long term.
What is the life expectancy for someone who has MS?
But we don't have a ton of information, really useful information on life expectancy in MS, especially in the era of newer treatments that have been out for relatively shorter periods of time. But more likely than not, life expectancy in MS is probably not reduced all that much, not more than single-digit years, depending on the study that you look at. But I think the more important thing to realize is that in MS, we are more concerned about developing bothersome symptoms or disability rather than a big impact on life expectancy, which doesn't typically happen that much.
Is it okay for someone with MS to get pregnant? Does it affect fertility?
So MS does not impact fertility and does not increase the risk of miscarriages, which is good news. With regards to considering pregnancy, there's a lot of different factors that play in terms of treatment considerations, MS disease-related considerations, and kind of timing of pregnancy. So I always recommend that patients discuss any plans for pregnancy with their MS neurologist as well as their obstetrician.
Okay, we've got one more question for you. Is there a connection with having MS and other autoimmune conditions?
This is actually kind of a challenging question to answer because we don't have a lot of good quality data on this. So there have been a lot of reports of different autoimmune diseases that occur in conjunction with multiple sclerosis. But what we don't have a lot of information on is whether those conditions actually occur at a higher rate relative to the general population. And it also may depend on certain other factors, like certain autoimmune conditions may be more associated with MS than others. But I don't think that we can clearly say that across the board there is an increased risk of autoimmune disease in MS. That, in part, like I said, has to do with limitations with the studies and data that we have available right now.
Wonderful. Thank you so much for your time today, Dr. Bet-Shlimon. We appreciate you sharing your expertise with us. For those watching, if you'd like to learn more, you can visit our website at the link shown on the screen. Thank you, and have a great day.